And today is also about promoting education of overdose response and amplifying the voices of those working to help make a difference.
Our Andrea Williams tells us about a doctor who's doing just that. Andrea.
Hi, Carol and Ryan. Dr. Selahattin Kurter is one of Milwaukee's leading experts in the field of addiction medicine. He talked to me about what's needed to better assist those with addiction disorders and a newer drug that's hitting the streets that's just as powerful as fentanyl. What are your thoughts in where we are with this epidemic?
It's a mixed picture. In one way, there's innovation occurring every day. We're also having some difficulties. We're seeing shifts in an ever-evolving epidemic.
That shift includes newer novelty substances like the animal tranquilizer xylazine, also known on the streets as Tranq.
Tranq is a sedative drug that started hitting the streets a few years ago, mostly on the West Coast and on the East Coast. But we started hearing about it about a year ago hitting the Wisconsin area.
This so-called zombie drug, which can cause skin rotting and even amputation, is being mixed with drugs like fentanyl, heroin, and cocaine. It's fueling overdoses across the U.S.
If you look at the medical examiner now, about 5% of people dying from opioid overdose also have this drug called Tranq or xylazine. The difficulty is that it's not treatable with Narcan, the reversal agent. The other thing is it doesn't show up commonly on a drug screen.
It is important to note that xylazine is a sedative and not an opioid. It's intended for use by veterinarians on animals like cows and horses. Just to give you an idea of how potent it is, a 1,200-pound horse would only need about 2 cubic centimeters as a dosage. This pharmacist at We Care Pharmacy showed us that exact amount.
It seems like what's on the street is always adapting and becoming deadlier.
Dealing with substance abuse, alcoholism, or drug addiction is never easy, and it's even more difficult when you're also struggling with mental health problems. Dr. Kurter says one of the main components to really helping those with addiction is addressing those mental health issues.
In Wisconsin, unfortunately, we're seeing still a lot of parity violations by major insurers where they're not covering the resources that are needed for patients who are suffering from mental health and addiction issues.
His patient Simone agrees. She's been sober from alcohol addiction for 7 years now, but knows it's not always easy to obtain state insurance coverage for treatment.
Getting on state insurance, my family paid for one of my rehabs because I was not accepted. What got me on state health insurance was I slipped on the ice and went to St. Francis Hospital and ended up in ICU.
Research by the National Institute on Drug Abuse shows that when treating addictions, medication should be the first line of treatment, usually combined with some form of counseling.
It's really a one-on-one space for them to grow and heal. And it's also a space that sometimes they can bring in loved ones into their sessions if it's, appropriate.
Dr. Kurter is extremely passionate about his work helping those battling addictions. And earlier this year, he was also able to show his compassion for humanity. He traveled to Turkey with Humanities First to help after that devastating earthquake that claimed the lives of 50,000 people.
I think that was one of the most rewarding aspects of my life.
A wise man once said, helping other people can be a cure, not just for those who are in need, but for one's soul as well. A huge thank you to Dr. Kurter and his staff for giving us insight on this very important subject. The West Grove Clinic is located in Milwaukee, Kenosha, Appleton, and Marinette. And you can find a link to their website right there at tmj4.com.
Yeah, we talked about addressing the mental health challenges and, that need to just, get past the stigma and make sure that people know resources are available.
Absolutely. And most importantly, making sure people have the resources to get covered.
Yeah, and I guess a lot of people who get this Tranq may not even know they get it.
Oh, absolutely, because it's being mixed with fentanyl and it's also been mixed with cocaine and heroin. And so people have no idea, just like when fentanyl's laced with things, they don't know what they're taking and there are no strips to test it.
Yeah.
So it's just a very scary world.
Very frightening. Oh, okay. Well, thank you for enlightening us, Andrea.